Hi, it's Dr. Tracy Murray again, and now we're going to move on and discuss clinical preparedness. Clinical rotations are an exciting time for students, as this means that you're now one step closer to becoming an APN. In order to be successful, you need to be prepared. So in this lecture, we're going to discuss everything you need to know about your clinical rotations and the expectations for this course. I'd like to start off by going over the clinical requirements to complete the FNP program. There are 5 clinical courses, NR 511, 601, 602, 603, and 661. Each of these courses has a didactic component as well as a clinical component. At Chamberlain, we're committed to providing you the best opportunity to successfully complete the FNP program and pass the National Board Certification exam. In this program, your clinical experiences play a significant role in that preparation, and a well-rounded clinical experience is the key to success. As a result, the clinical requirements of the program have and may continue to change over the course of time while we continue to evaluate the success of our previous students. Right now, the current requirements are as follows. For NR 511, 601, and 602, there are 3 options. You can do an internal medicine rotation, which will require a separate pediatric rotation before the completion of your program. You can do family practice. You can also do pediatrics for 1 session, knowing that you will have to do a minimum of 2 courses in either internal medicine or family practice before your program ends. For your last 2 courses, we allow certain specialty primary care sites, as long as you do make sure that you satisfy the pediatric and primary care requirements. Some of the options here would be urgent care, retail clinic, college health center, prison, home health centers, and mobile units, for instance. Practicum sites need not correspond with the topic of the current course, but at the end of your practicum preparation, you must demonstrate through your documentation achievement of a well-rounded clinical experience. Let's discuss what we mean by a well-rounded experience a little further. Both state boards of nursing and the national certification exam bodies can ask to audit your clinical hours when you apply for testing and licensing. If they feel you don't have a varied enough experience across the lifespan, they can refuse to allow you to sit for your exam or be licensed as a family nurse practitioner. A rule of thumb for them is 15% of pediatrics and 15% of women's health exposure of your total clinical time in a program. Now be aware that just because you're planning to stay at a family practice site for all rotations does not automatically mean that you'll get the appropriate exposure to all age groups and acuities. Although faculty does review and approve sites prior to your rotations, we can't guarantee that all populations that you see will be represented in the patients that you have exposure to. For example, some family practice offices may offer services for children starting at the age of birth or 2 weeks, but they might rarely have the opportunity because a lot of families go to pediatricians. Additionally, some family practice offices only allow for children of certain ages or minimum ages, such as 2 years old or 5 years and up, or they might not provide vaccinations for school-aged children. If you stayed at a site that had these restrictions for all 5 courses, you'd be missing opportunities. All students are subject to review of clinical logs to ensure that they've received a well-rounded experience. It is the responsibility of you, the student, to seek out the experiences that you are lacking. This may require a delay in your progress and an alteration in your clinical plan. Ultimately, it is your responsibility to determine if you have obtained the needed exposure before graduation. Although there are no set numbers of types or ages of patients seen, a true well-rounded experience will include both children from birth through young adult visits for well child and acute visits, as well as adults for wellness and acute or routine visits. You should also be able to display a variety of decision-making complexity by means of documenting the Office Evaluation and Management or E&M codes for the visit. And as you should recall, the higher the level of the code, the higher the complexity of the visit. The majority of your clinical time should be spent in the outpatient primary care setting. However, rounding on patients in the hospital is permitted under the following circumstances. Your course instructor must be made aware that you'll be rounding. The preceptor has to have facility privileges where the rounding will occur. Patients seen in a facility are patients of the provider's outpatient practice. The student actively participates in the patient's care, which means you can't take credit for observing. And time spent is no more than 25% of your total practicum hours for that course. The clinical portion of each practicum course is pass-fail. In other words, you cannot pass the class if you do not successfully complete all requirements of the clinical practicum. There are no additional points given for meeting the requirements. The non-graded clinical components include: you have to complete a minimum of 125 hours of patient care in the practicum setting. You have to have a successful midterm and final evaluation from your preceptor and course instructor. You must submit an evaluation of your clinical site and preceptor. And then you also have to show your clinical experiences by means of the database or clinical experience program that we're using. Using the data that's entered, the faculty can view the students' progress in their clinical activities and note whether students are meeting their course objectives or not. Now, clinical time is based on patient care hours, not clock time, and includes the time spent prepping for the patient encounters, so chart reviews and lab reviews, etc. Time spent discussing a plan of care, writing the SOAP note, and any teaching that the preceptor provides is also included. You are also allowed a maximum of 15 alternative hours per course, but they must fall into one of three approved categories: telephone management, prescription refills, or lab review. Make sure that you input your patient time accurately. For NR 511, you should be seeing at least one patient per hour. As you move through the subsequent rotations, your time spent with each patient visit should decrease. You're expected to enter at least 50 encounters or 50 hours prior to midterm, and a minimum of 125 hours by the Wednesday of week 8 in order to pass. Your clinical log represents your experience. Therefore, every patient encounter should be documented. Data for each encounter should include the date of service, the age, the gender and ethnicity, the visit or E&M code, chief concern, procedures, tests performed or ordered, diagnoses, and the level of involvement. And that means mostly student, mostly preceptor, together, etc. Now, clinical logs are legal documents, and they demonstrate your exposure and expertise in learning. Once a course is complete and your final grade is given, the clinical logs are closed, so you cannot amend, add, or delete encounters for a course. If you're found to have altered your clinical logs after a course has ended, you will have violated the academic integrity policy, and you will be subject to sanctions up to and including expulsion from the program. Now, you may or may not be allowed to document in the EMR at your clinical setting. If you are, you must complete any required training by the facility. This is not considered to be patient care, and thus it can't be counted towards your clinical time. In some instances, you'll find your preceptors prefer to write or submit their own notes. And if this is the case, what you should do is write your version of the encounter in a SOAP note format on your own and ask your preceptor to review it if time allows. So before we talk about your responsibilities as a student in the clinical setting, I want to take a moment to discuss what Chamberlain's qualifications and responsibilities that we expect of the preceptor are. First of all, For advanced practice nurses, they either have to be masters or doctorally prepared APNs with an unencumbered and current state license. They have to have a national board certification in their area of specialty, and they must have a minimum of 1 year of experience in their APN role. Now, PAs have to be masters or doctorally prepared, also with an unencumbered and current state license. They also must be nationally board certified. They must also have a minimum of 1 year experience in their role, but they also have to have a supervising physician that is contracted with them, and that physician's paperwork also has to be submitted. For physicians, they need only an unencumbered and current license to practice as a physician in the area of their specialty. So let's talk about the preceptor responsibilities. We expect that the preceptor should do the following: arrange a schedule with the student for completing the necessary hours. Give the student an orientation to the site early in the experience. This will facilitate a smooth transition into the site and optimize the use of available resources. Provide appropriate office space and office materials for the student if necessary. Explain their expectations of the student. The areas of dress, conduct, scheduling of hours, and general characteristics of the experience should be discussed. Allow sufficient time for supervision and instruction in the form of routine interactions. Guide the student in his or her next steps and ask to review work periodically. Provide the student with constructive feedback. Afford the student the time and patience needed for an optimal learning experience. Now, on the other hand, students must remain compliant with their immunizations, drug screening, CPR, and HIPAA training throughout all of your clinicals. If your PPD, tetanus, flu immunization, or CPR expired, you cannot go into your clinical site until they're up to date. There's no grace period. It's expected that all students will arrive at their clinical site appropriately clean, dressed, and groomed. An ironed and clean lab coat is usual unless you're directed not to wear one by your preceptor. The lab coat must have the Chamberlain College of Nursing patch neatly affixed to the coat, and your Chamberlain College of Nursing student ID badge should be worn at all times, and your name and picture should be visible to the patient and staff at all times. Professional attire for women is expected, and this includes conservative jewelry consisting of small earrings, no more than 2 pair, no other visible piercings, no tongue jewelry, low-key makeup, and no artificial nails. Nails should be well trimmed and not extended beyond 1/4 inch from the end of your finger. If nail polish is worn, it should be neutral. Tops should cover the abdomen at all times. And here's a hint that if you stand in front of the mirror and raise your arms, if your skin is showing, then the top is too short. Cleavage should not be visible when sitting up straight or leaning forward. Slacks or skirts should be modest. Skirts shorter than the top of the patella should not be worn to clinical. Remember that clinical practice is active and may require standing, stretching, and bending over, so hair should be well groomed and pulled back and secured if long. Shoes should be appropriate for a day's standing, and you need to avoid open toes or high heels. Jeans are not appropriate, even if other members of the staff wear them. The professional attire for men is similar. You must have ironed shirts with collars and a tie if other male providers wear ties. Dress slacks, socks, and shoes are a must. Jeans, sandals, and sneakers are never appropriate, even if other providers wear them. A wedding ring or conservative ring is permissible. A small earring is permissible, but no other piercings should be visible and no tongue jewelry. Nails should also be well trimmed and not extend over 1/4 inch from the end of the nails. No nail polish is permissible. Men should be clean shaven or may have a neatly trimmed beard and mustache. Now, all students should refrain from using perfume or cologne in the clinical setting. Some patients are very sensitive to smells which may exacerbate the condition. For example, the perfumes tend to make migraines worse or make nausea worse. You should also be cognizant of your body odor. In some cultures, the use of deodorant may not be common practice. However, you should be taking into consideration that your odor may be offensive to patients, much in the same way that perfumes or colognes can be. Use of deodorant by students in the clinical setting is strongly recommended. All forms of class assignments and/or discussions are to be free from any and all information that could potentially lead back to the identification of a patient or their situation. Although we recognize the value of dialogue surrounding circumstances that present as unique and perhaps can be seen as relevant for teachable moments, protecting patient information takes precedence. For the purposes of learning and improving care, potentially identifiable information should be masked so that all parties are protected. Violations of patient confidentiality will be handled by the Professional Misconduct Committee within the college and according to agency policies wherein the violation has occurred. Cell phone calls and texts are not allowed in the clinical setting except in the case of an emergency. Cell phone ringers and text notifications should be muted upon entering the workplace. If you must make a call, it should be done on a designated break or lunch hour. Remember that you are a guest in this facility and you represent Chamberlain University. The use of social networking, although common in our lives outside of our professional roles, is associated with significant risk of violating patient privacy when professional matters are discussed on social networking sites. Even if patient names are not used, patients and facilities may still be identifiable to other persons reading the post. It is never appropriate to contact a patient through social media. Now let's talk about clinical preceptors. You can only use preceptors that have been approved by faculty through the vetting process in your practicum application. So if your original preceptor is not available, but another provider in the office is willing to take you on, this preceptor has to be approved just like your original preceptor was before he or she can be used. Any hours that you spend with a preceptor that has not been approved will not count. So it's advisable that you have at least one backup preceptor documented with Chamberlain and approved for each clinical practicum in case your first preceptor becomes ill or is out unexpectedly. Other things you have to know, well, you're not allowed to follow a preceptor in the office. And if you do, you can't count any of this time towards your clinical hours. You're to be actively evaluating patients and developing a plan. On the first day in the office, it's acceptable to shadow your preceptor in order to gain a grasp of office procedures and the flow of patients. But again, you can only count the clinical time with the patients that you participated care with. So if you're shadowing for the full day, you can't count those hours. Beyond that, you should be researching the patient's chart, performing a history and physical, and any of that workup or any of that process can be documented as your clinical time. In the first part of the course, you'll need some help in developing the differential and coming up with a treatment plan. However, as the course progresses and you become more confident, you should be able to need less of your preceptor's input. You should never see patients on your own, and the preceptor must always have some level of input or review of their patients you see, because ultimately they're responsible for the patient's care. Communicate with your preceptors. Remember that you're a guest in the preceptor's office, and these are not your patients. Be considerate, observe office policies, be respectful to all of the staff, and don't argue. Additionally, it's never a good idea to point out to a preceptor that their method or practice is incorrect from what you've been taught. You also want to discuss your clinical goals on day one with your preceptor. Verbalize that this is your first clinical in the program and that you realize there's a lot to learn. Admit that you're just starting to formulate differentials and develop evidence-based medicine treatment plans in class. Although you may lack knowledge and experience in the beginning, you should be showing progress week to week and becoming more independent. Finally, let's discuss presenting a patient to your preceptor or instructor. By now, you should have a solid understanding of the components of a visit, which are the history and physical, differential diagnosis, and plan. Although this might be easy to do on paper, most novice students find it difficult to present this information in an organized and concise manner to their preceptor or instructor. So I'm going to share with you a technique called SNAPS. SNAPS is a mnemonic that breaks down your patient presentation into 6 parts. The first part, the S in SNAPS, stands for summarize. This is where you present your patient's history and physical exam findings. The N stands for narrow, and that's where you narrow your differential down. So essentially, based on the history and exam findings, you find your top 2 or 3 differential diagnoses. A stands for analyze, and this is where you'll analyze your differential. At this point, you compare and contrast the history and physical exam findings for each of the differentials that you have, and you ultimately come down to the one most likely diagnosis based on your data. The next part is the P, which stands for probe. This is where you can ask the preceptor questions about things that you aren't quite sure about. And the last P in SNAP stands for plan. This is where you'll come up with a management plan, being as specific as possible. Finally, the S in SNAP stands for self-directed learning. This is your opportunity to investigate more about a topic that you're still a little unsure about. You will be expected to present a patient in the SNAPS format during clinical and in the SNAPS assignment during this course. To help you gain a clearer picture of the SNAP presentations, please view the 2 video lectures on SNAPS.